I think our vision as well for the future would be that we would have more knowledgeable patients that will become more actively involved in their care. There's a lot of evidence, for example, that patients don't always follow the prescriptions they get from doctors. About 5% of prescriptions that doctors write for patients are actually never dispensed for them because the patients don't pick them up from the pharmacy. Equally, when patients do pick up their medication, the evidence is that between 30 and 50% of that medication may never be taken. So patients themselves are not adhering to their care, and we have to ask ourselves, why is that? Is that because they don't understand their care, or is it because they're making decisions about their care themselves that perhaps we don't understand and that we need to understand them better? A lot of the time when patients make decisions not to take their medication, when they go back to their healthcare professional, they don't admit to those decisions because they perceive themselves as letting the healthcare professional down by not taking their medication. So to keep us happy, they tell us they're taking their drugs even though they weren't. And if we can get to a point where patients are sufficiently knowledgeable that we can have them realise that it's okay for them to make those kind of decisions about their care, provided they're making them in a knowledgeable way and that they understand the risks and benefits associated with those decisions, but that we can have honest conversations between the professions and the patients.